So welcome, Dr. Power. We're excited to have you here today.
Thank you.
It seems like hormone replacement therapy, or HRT, conversation is everywhere. It's in the media, it's in a lot of print, and people have lots of questions. Can you help us understand a little bit about the difference regarding synthetic and bioidentical hormones?
Yes, I spend a lot of my time educating people about the differences in hormones, the synthetics versus the bioidenticals, and there has been a lot of controversy in the media. The hormone system is very powerful. The hormones tell your body when to grow, when to heal, when to rest, and over the years those hormone levels decline and the signals are lost. So the body is left sort of without communication, without a goal, without a message. So that's where we get chaos and we have the body fall into decline. So that's why the hormones are extremely important and why hormone replacement can be such a valuable tool, such a powerful tool. The controversies come up because we knew that hormones were important and we replaced hormones for many years. However, we were using synthetic hormones. And synthetic hormones do not look in the human body the same as a bioidentical hormone. So it's not recognized by all the tissue in the body. So it can have some effects that are positive, but it can have many effects that are negative. And unfortunately, it doesn't have all the same effects in the body.
It seems like in the past, hormone replacement therapy was almost a one-size-fits-all approach. One of the things that you've spoken about is customizing and individualizing your protocol for patients. How do you do that? Can you talk a little bit more about the differences between one person to another regarding hormone replacement?
Yes, absolutely. It's never one size fits all, and it's very difficult to predict exactly what levels of hormone any individual might need. It's always based, in my experience and in my practice, it's always based on a lot of communication between me and the patient. I do questionnaires and I spend a lot of time just talking, and also I always use lab tests. It's critical. Everybody's different. Everybody makes different amounts or levels of hormones, and people balance their hormones differently. They do different things with their hormones in their body. Some of that is because of different environmental exposures, especially toxin loads inside the body, and a lot of those differences are genetically driven. It's impossible for me just to look at somebody and predict exactly what levels they'll need. It takes a lot of adjustment and fine-tuning to get the right amount.
Interesting. And also, the old kind of way, very simple way of thinking about hormones is, women, estrogen, men, testosterone. Can you talk a little bit more about that?
It's far more complex than that. And really the endocrine system, the hormone system is a complex web. And men and women actually have the exact same hormones in their body. It's just different levels and different proportions. So of course women have higher levels of estrogen, but men have and need estrogen as well. It's all about the proportions, and it's all about the balance, both for feeling your best and for safety.
When I look at the statistics about who's accessing health care and looking at treating their health, usually it's women, or the majority. Mm-hmm. Have you seen a shift with men reaching midlife and beyond and looking for some alternatives or to feel better?
Right. I'm seeing more men in my practice than I was years ago. And I think that's a wonderful trend. I think that's very important.
What might men notice as their testosterone is declining towards, let's say, midlife and even beyond that? What are some of the symptoms that they might be experiencing that maybe in the past they wouldn't have attributed to low testosterone that we are now understanding to be a possible manifestation or symptom of low testosterone?
A lot of the sort of decline of aging that men just think of as sort of normal or natural aging, oftentimes some of those symptoms are related to low testosterone. So again, they can be corrected. Some of those things are decreased sense of wellness, feeling that they've lost their edge, feeling soft, both mentally and physically soft. So I see men complaining of increase in aches and pain, back pain, joint pain, poor quality sleep, fatigue, loss of ambition and confidence, and a sense of wanting to take on new things, learn new things, or experience new things. Of course, there's the loss of libido, and that one's a little bit more obvious. Most men realize that that's testosterone driven or related, but that's just a small fraction of the symptoms that come along with the decline in testosterone.
Besides testosterone's use to reduce symptoms in men, what other health benefits does testosterone have?
Testosterone is very helpful in controlling many different symptoms, and it does improve a man's quality of life. But it also helps to prevent some of the diseases that are associated with what we call andropause, or that decline in testosterone. Some of those diseases are stroke and heart attack, dementia, Alzheimer's, depression, anemia, osteoporosis, and diabetes. These are all diseases that are associated with a decline in testosterone. And in fact, there have been a couple of large studies that have looked at all-cause mortality, that is, every cause of death, and testosterone levels. And it's been found that with the highest level of testosterone, the risk of death is almost 60% lower than for men with the lower range of testosterone. Another study showed that, again, the men with the lowest testosterone levels had almost double the risk of overall death than men with the higher testosterone levels. So it's clear that this is a hormone that is really associated with health and wellness in a man.
So Dr. Power, what if a man has gone to his GP and had his testosterone levels tested, and he's been told that those levels are normal, yet he's still experiencing some of those symptoms and bullet points you gave us that might represent a low testosterone level in the body? How do you address that?
I've seen this very frequently, very commonly. And the issue lies primarily in how you define a normal testosterone level. The normal ranges are extremely wide. That is, when the lab results come back, the testosterone often be called normal. Those normal ranges were devised looking at men from their 20s up to their 90s and just taking an average. So if you are in your 30s, 40s, or 50s and your testosterone level comes back, quote, normal, you might actually have the normal testosterone level of an 80-year-old man. That might not be normal for you. Also, general doctors with the screening test often look at total testosterone. And I alluded before to how much of that's actually available. So there are other proteins in the body that bring down the total testosterone level, leaving a lot of it not available to a man. So overall, he's feeling a low testosterone and really is only seeing a very small fraction of that testosterone that's in his system. So with the right kind of testing, we can really determine exactly how much testosterone he's feeling and how much testosterone he should have for his age range.
There's also been some articles in the news regarding testosterone replacement and prostate health or prostate issues. Can you talk a little bit about that?
Sure. And this is something we all learn in medical school, is that testosterone is going to cause prostate cancer. It's sort of, in the medical world, an urban myth, an urban legend. There was a study in the 1930s done that demonstrated some correlation. It's never been well repeated because the correlation isn't really there. What really happens is that unopposed estrogen in a man is what is correlated with prostate cancer. So at very low testosterone levels, men have the highest rates of prostate cancer. At very high levels of testosterone, we get conversion into estrogen and other types of hormones that can be correlated with prostate cancer. So the testosterone is sort of an innocent bystander, but it for some reason is really stuck with us. And again, it's become an urban legend in medicine that testosterone causes prostate cancer.
So utilizing testosterone, a bioidentical testosterone for a male, is that something that they might even be able to use in lieu of, let's say, a prescription like Viagra?
Yes, it can be used in lieu of Viagra, and also it works very well in conjunction with Viagra. Viagra helps if there's a physiologic reason that a man can't achieve or maintain an erection. Testosterone really helps in the brain as well, increasing sex drive and libido. And the two in conjunction can really help correct sexual dysfunction. Again, that's a fraction of it. Most of the men that I treat with low testosterone, when I've improved their testosterone or restored their testosterone levels, I hear about improved sleep, decrease in aches and pain, increased stamina, ability to be physical, use their body the way they used to, with, again, fewer aches and pains afterwards, so shorter recovery time. I hear about improved memory and really very greatly improved mood. It can be a wonderful treatment for depression, which is often testosterone related. Improvement in skin and muscle tone, decrease in belly fat. So there's a lot of different benefits that come along with testosterone replacement.
What would you say is the average amount of time from when a man starts on, let's say, a testosterone replacement program for when they start to feel a change in their symptoms?
It depends on which symptoms. Some of the symptoms begin to correct quite quickly. Things like poor sleep. So their sleep gets improved quickly. Aches and pains, and that's within a matter of a few days or nights. An increase in stamina and endurance, that typically comes along at the 4 to 6 week mark. And then changes in body composition, improvement in muscle tone and decrease in body fat. Those are changes that I still see occurring at 3 months or 6 months. Usually by 6 months to 1 year, we've seen most of the improvement and changes. Although improvement in things like cholesterol, blood pressure, those changes can still, we still see improvement at the 1 year mark.
Would a man look at doing testosterone replacement long term? Is this kind of decades going forward in their life that they might be utilizing this type of protocol?
Yes, absolutely. We have men in their 90s still using testosterone treatment. But it's really dependent on the individual, how long they want to maintain their testosterone levels. As long as we're talking about maintaining safe testosterone levels, natural testosterone levels, basically maintaining a man at the levels he had when he was in his 30s, maintaining that for indefinitely, for as long as he would like to, into his 50s, 60s, 70s, and beyond. It can safely be maintained for decades.
What do you see as some of the changes that are happening in addressing hormones and genetics and hormone replacement, or any type of new testing or interventions that are happening in this field?
Well, there's a lot of areas of very exciting growth. Of course, I see it from my point of view in the areas that I would that I'm most looking forward to that extra help, and that would be in the testing, genetic testing. As I mentioned, everybody's very different in how the level of hormones that they produce, but also what they do with those hormones once they've produced them, and that's enzyme driven. So I can't immediately tell looking at somebody what their enzymes are like, but I'm hoping and waiting for that time when I can take a drop of blood and it will tell me which enzymes work well and which ones do not work so well in each individual. And then I can more quickly fine-tune and support those areas that need to be supported, both with nutrients and with hormones.
Thank you for joining us today, Dr. Power. It's been wonderful hearing the options that women and men have for maintaining vitality and wellness throughout their life.